When most people think about retirement income, they think about Social Security. And when they think about retirement health care, they think about Medicare. But here is what almost nobody talks about. These two programs are deeply connected to each other. The decisions you make about Social Security directly affect your Medicare costs. And the timing of Medicare enrollment can affect your Social Security payments. If you do not understand how they work together, you could end up paying hundreds of extra dollars every month in penalties and unnecessary costs. Today, I'm going to give you the complete picture of how Social Security and Medicare interact, what the most important deadlines are, the penalties you must avoid, and the best strategy for coordinating these two programs to maximize your retirement income and minimize your healthcare costs. Let us start with the basics of Medicare so we are all on the same page. Medicare is the federal health insurance program for Americans age 65 and older. It has four main parts. Part A covers hospital stays, skilled nursing facility care, hospice, and some home health care. For most people, Part A is free because they paid Medicare taxes throughout their working career. Part B covers doctor visits, outpatient care, preventive services, and medical equipment. Part B is not free. In 2026, the standard monthly premium for Part B is approximately $185 per month. However, higher income retirees pay significantly more through what is called the Income-Related Monthly Adjustment Amount, or IRMAA. Part C is Medicare Advantage, which is a private insurance alternative to original Medicare. Part D covers prescription drugs. Now here is the first major connection between Social Security and Medicare that most people do not know about. If you are already collecting Social Security when you turn 65, you are automatically enrolled in Medicare Parts A and B. You do not have to do anything. Medicare enrollment happens automatically. But if you are not yet collecting Social Security when you turn 65, you are not automatically enrolled. You must actively sign up for Medicare during your initial enrollment period. Your initial enrollment period is a 7-month window that begins 3 months before your 65th birthday month, includes your birthday month, and extends 3 months after. If you miss this window without having qualifying other coverage, you face permanent late enrollment penalties. The Part B penalty is 10% added to your premium for every 12-month period you were eligible but did not enroll. And this penalty is permanent. It never goes away. It stays with you for the rest of your life. For someone who is 1 year late, that is a 10% permanent increase. For someone who is 3 years late, that is a 30% permanent increase on every monthly premium for the rest of their life. This is one of the most expensive mistakes a retiree can make, and it is entirely avoidable. Now let me address a common situation that causes confusion. What if you're still working at age 65 and have health coverage through your employer? In this case, if your employer has 20 or more employees, your employer insurance is considered primary and Medicare is secondary. You can delay enrolling in Part B without penalty as long as you have qualifying employer coverage. But when your employer coverage ends, either because you retire or leave the job, you have a special enrollment period of 8 months to sign up for Part B without penalty. Do not miss that 8-month window. Once it closes, you fall into the general enrollment period with potential penalties. Now, let me talk about the income connection between Social Security and Medicare. This is where the interaction gets really important and potentially very expensive. Your Medicare Part B premiums are not the same for everyone. High-income retirees pay significantly more. SSA determines your Part B premium based on your income from 2 years ago. So in 2026, your premium is based on your 2024 income. The income thresholds in 2026 that trigger higher premiums are as follows. If your income is below $88,000 as a single filer, or below $176,000 as a married filer, you pay the standard premium of approximately $185. If your income is between $88,000 and $111,000 as single, you pay approximately $260. If your income is between $111,000 and $138,000 as single, you pay approximately $365. At the highest income levels, you can be paying over $580 per month just for Part B. And remember, these premiums are typically deducted directly from your Social Security check. This means high-income retirees see a significant portion of their Social Security payment immediately taken out from Medicare premiums before they ever see a dollar. This is why income management in retirement is so critical. Strategies like Roth conversions and careful management of retirement account withdrawals and timing of capital gains can all affect which IRMAA bracket you fall into, and therefore how much of your Social Security benefit you actually keep. Now let me talk about the Part D prescription drug penalty because it is less well known but equally important. If you do not sign up for Medicare Part D drug coverage when you are first eligible, and you go without creditable drug coverage for 63 or more days, you face a permanent late enrollment penalty. The penalty is calculated as 1% of the national base beneficiary premium for every month you went without coverage. In 2026, that base premium is approximately $34. So if you were without coverage for 24 months, your penalty would be approximately 24% added to your premium permanently. Over 10 years, this penalty can easily cost $1,000 or more. Now let me tie everything together with the best overall strategy for coordinating Social Security and Medicare. If you're planning to claim Social Security before 65, Medicare enrollment is straightforward because you will be automatically enrolled when you turn 65. If you're delaying Social Security past 65, which is often the right strategy to maximize your benefit, you must proactively enroll in Medicare at 65 to avoid penalties. You can sign up for Medicare even while delaying Social Security. They are two separate programs, and you can be enrolled in one without the other. The mistake many people make is assuming that because they are delaying Social Security, they do not have to worry about Medicare yet. That is wrong and expensive. Here is the recommended timeline for most people. 3 months before your 65th birthday, begin your Medicare enrollment process regardless of when you plan to claim Social Security. Evaluate which Part D drug plan covers your medications at the lowest cost, as plans vary significantly. Consider a Medicare supplement, also called Medigap, policy to cover the gaps in original Medicare. Understand how your income level affects your Part B premiums and plan your retirement income withdrawals accordingly. And coordinate the timing of your Social Security claim with your Medicare enrollment to avoid any gaps in coverage. For many people, the most financially optimal strategy is to enroll in Medicare at 65 while continuing to delay Social Security until 70 to build the maximum monthly benefit. This requires having another source of income to cover living expenses in the gap years, such as retirement account withdrawals, pension income, or a spouse's income. But the combined result of maximum Medicare coverage starting at 65 and maximum Social Security starting at 70 creates the strongest possible foundation for retirement and financial security. Let me summarize the key points. Medicare has 4 parts: A, B, C, and D. Part A is generally free. Part B has a standard premium of approximately $185 in 2026. If you are on Social Security at 65, Medicare enrollment is automatic. If not, you must sign up during your initial enrollment period or face permanent penalties. High-income retirees pay more for Part B through IRMAA. Part D has a late enrollment penalty too. You can and should enroll in Medicare at 65, even if you are delaying Social Security. Please subscribe for more Social Security and retirement planning strategies every single week.